Alrighty, perfect. So this policy is one of the new policies through United Healthcare. It's going to be under their Choice Plus PPO network, so that's going to give you nationwide coverage in all 50 states, allowing you to go to any doctor, any hospital that you would like to go to. Now, I'm not going to give you a full rundown on everything. I'm assuming if you're watching this video, you're probably pretty busy and you don't want to spend an hour watching a video, of course. Otherwise, we could have just done a phone call. But to keep it short and sweet, we don't know what the monthly premium is. This policy goes based off of your health. So if you are somewhat healthy, you would be able to leverage your health to get a cheaper premium, significantly cheaper, while also getting better benefits, like a good car driver with car insurance. Now, the approval process, Freedom Life will be the underwriters. They will be the ones that determine if you can get this policy. What they require is for you to submit an application. There are 5 parts of that application process, which we would go over if you decided that this was something you wanted to do. Now, to go ahead and get into it, we're going to go ahead and start with Premier Advantage, which will be the first portion. Premier Advantage is going to be for your day-to-day doctor visits, health and wellness, preventative care, testing, urgent care, doctor office visits, um, chiropractic, of course, specialist, prescriptions, the whole nine. As you can see in the top, there is no deductible and also no copay. So what that means is that no deductible, there is no amount for you to satisfy, making your benefits effective immediately. There is no $4,000 to $15,000 amount that you got to pay on a yearly basis for benefits to kick in. Now, since there is no deductible, you'll have access to your benefits immediately on this portion. There's not a co-insurance or a copay, simply meaning the chances of you coming out of pocket are absolute slim to none. Now, the reason why I say that are because of these dollar values right over here. These dollar values are not what you're paying. These are first dollar benefits. The best way I can put it is on this policy, you get 2 benefit amounts. The first one is the PPO benefit. That's going to pay most of whatever the medical bill is. After that, the additional benefit, these dollar values will kick in, covering the remaining portion. Now, you will get 6 of those additional benefits per person per policy year. What that means is that you're not limited to 6. It just means that for 6, chances are, more than likely you're not coming out of pocket. If you were to exceed 6, that's when there'd be some form of payment. But I'm sure if you made it this far, you don't see yourself or anybody in your family going to the doctors more than 6 times. Now, with that being said, since you're not going to the doctor more than 6 times, any of the unused visits that you do not use roll over into next year, kind of like rollover minutes. There is one waiting period on this policy. What is that waiting period? So for preventative care, physicals, immunizations, pap smears, colonoscopies, everything in that nature will have a 30-day waiting period for its benefits to kick in. So everything else is effective immediately besides your preventative care, which is what that section's called. Keep in mind that this is a PPO, so regardless if your doctor's in or out of network, you will still be covered on this plan nationwide. Premier Med's going to be your catastrophic safety net. So what does that mean? So cancer, heart attack, stroke, anything inside that nature. Premier Med would kick in and cover you at 100% after you pay a $3,000 deductible. So to be fully transparent, there is no deductible and no copay on this policy besides your catastrophic. For catastrophic, you have a $3,000 deductible. But statistically speaking, if we're comparing $3,000 to the national average medical claim for a heart attack, which is $500,000 to $600,000, I'm sure you would say that's fair. After that deductible has been paid for, you would be covered at 100%, up to $10 million, $5 million for sickness and $5 million for accident. It's also going to cover anything that may stimulate, like I said. So God forbid you found out you had cancer, needed surgery to remove a possible tumor, or even needed chemo slash radiation therapy since it's stimulating from that situation. Now, even though you have a $3,000 deductible on this policy, you would be responsible for paying it, but you wouldn't pay it with your own money. And the best way to explain it is MedGuard. So MedGuard is living life insurance, uh, kind of like Aflac on steroids. So God forbid, uh, and this is just an example, keep that in mind. Your lump sum benefit will be different based on how many people you have on the policy and also how old you are. But an example for person one, they would receive $29,000 in the event of a critical illness. This is a living benefit. So if they had a heart attack, they would be paid $29,000. Name another policy that's going to essentially pay you for suffering a heart attack. And person two would get $18,000. So when it comes down to it, you can take that $3,000 from that lump sum benefit and apply that to your catastrophic coverage, $3,000 deductible, since they both practically kick in for the same reasons. Um, After you pay that deductible for Premier Med with MedGuard's lump sum benefit, person one would have, excuse me, I'm not the best at math. Person one would have 26,000 and person two would have 25,000. Excuse me, 15,000 to do whatever with. I know it's not the biggest amount in the world. It's not supposed to make you rich overnight, but at the end of the day, it's definitely going to take away any type of financial stress you may be experiencing due to the fact that in that present moment, you're not able to work.